Breast cancer is the most common type of cancer for women in the United States and the second leading cause of cancer deaths in women each year. Approximately 1 woman dies every 13 minutes due to breast cancer, according to the Susan G. Komen website. In the next few minutes, I will explain different aspects of breast cancer. First, I will inform the risk factors and when you should get a mammogram. Then I will inform you on the stages of this cancer. Finally, I will tell you about the different treatment options available for women who have breast cancer. I'll begin by talking about the risk factors of breast cancer. Since breast cancer is the most common cancer among women in the United States, it is important to get regular checkups to make sure your breasts are healthy. Women over the age of 40 should have regular mammograms if they have risk of having breast cancer or have shown signs of potential cancer. Risk factors include gender. Being a female automatically increases the risk of getting breast cancer. Age. Your risk of getting breast cancer increases as you get older. According to Grabstein, the author of the breast cancer book, age is the single most important risk factor of breast cancer. Diet. A high-calorie diet and a high consumption of fat has a possible connection to breast cancer. Women over the age of 50 should have regular mammograms every 2 years, even if they do not show any signs of potential cancer or have the risk for developing the cancer. These two graphs here show the correlation between breast cancer and age. As the person gets older, their incidence rate gets higher, and as the age gets higher, the death counts also go up. Most women do not know they have breast cancer until it's advanced. I will now explain the different stages of breast cancer. There are 4 main stages. It is useful to determine which stage you are in to know what to expect and what your prognosis involves. Stage 0 describes breast cancer that does not spread to surrounding tissues, usually described as non-invasive. At stage 0, there is no sign of cancer or cancer-producing cells. Stages 1 through 4 are stages describing invasive breast cancer. The prognosis gets more complicated as the cancer develops. Stage 4 is the highest stage and is described as having breast cancer that has spread to the organs of the body. Although breast cancer is a very serious and possibly fatal cancer, there are several ways to get treatment. A person who has breast cancer has many options for treatment. Some treatments are more effective than others for some people. It is best for the person to talk to their doctor to see which options are right for them. People with breast cancer can get treated by having surgery. There are numerous choices of surgery. The most common ones are lumpectomy, mastectomy, and lymph node dissection. A lumpectomy is simply the removal of a lump from the breast. It may or may not be a cancer-spreading cell. A mastectomy is a surgery to remove all or part of the breast. Lymph node dissection is a surgical procedure to remove lymph nodes and to examine them to see if they have cancer. In addition to having surgery, women usually get treated by either radiation therapy or chemotherapy. Radiation therapy kills the cells that may be left over from surgery. Although there are many side effects with radiation therapy, it is very effective in ensuring that the person will not develop cancer cells in the breast again. Chemotherapy uses medicine to destroy cancer cells left from surgery. Some people will have chemotherapy before surgery to shrink the cancerous cells. Some people may even have chemotherapy without getting surgery. Chemotherapy affects the entire body because it goes through the bloodstream. High doses of chemotherapy can cause a great deal of fatigue, especially on the first day after treatment. It is important for people to talk to their doctor about different options available and which one is right for them. This graph shows the connection between race and age and breast cancer. African American people have the highest death count in breast cancer, followed by white people and then Hispanic people. This table shows the survival rate by stage. At stage 0, the survival rate is 93, and it drops down to 15% at stage 4. For the past few minutes, I have provided you with information about breast cancer. I have talked about the risk factors, I have explained the different stages, and lastly, I talked about the different treatments available. Breast cancer is a very common disease among women. With regular mammograms and checkups, your doctor can determine if you have this cancer. It is important to have these appointments with your doctor, considering the cancer can spread if it is not taken care of as soon as possible. Although there are hundreds of thousands of women each year that develop breast cancer, more than 75% survive due to early detection and cancer treatment.